Support for this episode comes from EdgePark. Managing diabetes doesn't need to get in the way of your passion, your social life, or your budget. EdgePark can help you simplify your diabetes journey so you can focus on other important things. EdgePark offers a wide array of continuous glucose monitors, such as the Dexcom G7, Freestyle Libre 3, and more. Plus, EdgePark accepts most insurance plans and handles the paperwork. Go to diabetes-connections.com and click on the EdgePark logo to learn more.
This is Diabetes Connections with Stacey Sims.
This week, let's talk about the Rebel Health Alliance. That's what my guest calls the patient-led movement to improve health and health care. Susannah Fox served as the Chief Technical Officer for the U.S. Department of Health and Human Services. She's got a new book out called Rebel Health. If you're thinking, hey, that sounds like a lot of the diabetes community, you're right, and we talk about it. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know, we aim to educate and inspire about diabetes with a focus on people who use insulin. And before I go any further, thank you so much for the amazing reviews so many of you left after I asked about that last week. And also for the really nice messages about not worrying about those weird one-star reviews that led me to tell you about it and ask in the first place. I got to tell you, after all that time I spent in local television and radio, I do have a pretty thick skin, but podcast ratings are weird. You know, there's really no actual feedback sometimes. Some people leave their name and leave a real review, but, you know, you can just click 1 star and have absolutely no idea why. Anyway, thanks again for that. You guys always come through. If you have been around the diabetes community for a while, the term rogue cowboy might mean something to you. If not, I'll explain, and I'll try to do it briefly. Almost 10 years ago now, the do-it-yourself movement was really heating up. CGM share and follow in particular. It didn't exist as it does now. Quite a few people were working on automated systems and remote monitoring on their own, and many of them united under the "We Are Not Waiting" hashtag, and that was coined, by the way, I always like to give credit, at a Diabetes Mind D-Data conference. Well, industry leaders didn't like a lot of what was going on off-label and DIY, and they called these folks rogue cowboys who were giving into helicopter parenting. Well, since then, most of the features the cowboys wanted are now standard commercial technology for diabetes. I have a lot of early episodes all about this. You can search for We Are Not Waiting, all one word, over at diabetes-connections.com if you want to check out those episodes from back when we started the show, 2015, 2016, that sort of thing. All of that to say, when I saw Susannah Fox's book, and the full title is Rebel Health, A Field Guide to the Patient-Led Revolution in Medical Care, I knew I had to talk to her about it. I knew she would be on top of the We Are Not Waiting community, and I wanted to get her perspective about what has really changed. Because as I mentioned, among many other positions, she worked with the U.S. Department of Health and Human Services as the Chief Technical Officer. And one of the programs that she conceived of and launched there was the Invent Health Initiative, which was focused on user-driven innovation of medical and assistive devices. My conversation with Susannah Fox right after this. The all-new Dexcom G7 continuous glucose monitoring system is now available. Powerful and simple, Dexcom G7 is proven to lower A1C and help you spend time in range, all without finger sticks, scanning, or calibrations. There are so many amazing new features to talk about, I'm never sure where to begin. Dexcom G7 is 60% smaller than the previous generation and is the most accurate CGM system out there. The 30-minute warm-up period is fantastic and up to 2 times faster than any other CGM brand. And I love the all-in-one sensor and transmitter. To learn more, go to diabetes-connections.com and click on the Dexcom logo. Susannah, thank you so much for joining me. I'm excited to jump in.
Thanks for having me.
You got it. Before we talk about your book and get into what Rebel Health is all about, I do want to ask you, when I was reading up on you, you have a really great and long resume, but you served as the Chief Technology Officer for the U.S. Department of Health and Human Services. Can you tell me a little bit about, what does that mean? What did you do in that role?
It's a great title, The Chief Technology Officer is quite a title, and it sounds like maybe I was in charge of all of the email servers for the entire HHS. No, I ran an open data and innovation lab for the Secretary's office, which means that the Open Data Initiative was one that was started in the Obama administration, continued through the Trump administration, and continues today in the Biden administration. Open data is a nonpartisan, bipartisan effort across the whole government, and HHS has been a leader in this. And what it means is that data that is collected by the federal government should be accessible to the American people. And practically, that means that, for example, public health data produced by CDC should not be published as a PDF. It should be published in machine-readable format. So that was half the job. The other half of the job was running an innovation lab where we helped to bring in outside talent to high-impact initiatives. And I can talk about a couple of those. Basically, if there was talent that someone had in the technology space that an agency at HHS needed, we would recruit those people to come in. For example, data scientists for the CDC was a very popular one. We also taught federal workers how to think and act like entrepreneurs, how to place themselves in the shoes of their customer, which are citizens, and therefore improve the services of their agency.
I feel like we could talk about this for hours and hours, and I want to come back to it. But I would like to ask before we move on, there's so much confusion and I think concern, right, about our information, our health data, what the government is doing, what private groups are doing. Is there any advice that you have for regular people who may have understood? I'll be honest with you, I understood what you said, but I really got about half of it. It's very difficult, even though we live our lives online.
Well, there's a couple levels to talk about. One is the level of where I started. For example, the public health data that's collected by the CDC. That is data that is collected often at the state level and then fed up to the federal system so that we can understand the landscape of what's going on in terms of maternal health, for example, or another initiative is looking at actually death records are very interesting. We are able to see patterns in the landscape by collecting data at the state level that otherwise would not be visible. So, for example, the spread of opioids and the opioid crisis, or even the beginning of the COVID pandemic was seen in Washington state because there were people who were collecting information about deaths in Washington state, and they see early indicators that they can then send to the federal government and say, this is what we should be watching out for. So at one level, health data can be extremely broad and anonymized. And then there's the part of health data that is extremely individual. It's your personal health data, your electronic medical record data, for example. And the federal government oversees that very broad look at the landscape, and they also oversee regulatory guidance around that individual right that people have to have access to their own medical data. What I would say to people is that you can have confidence that the federal government is on the case, and this is a bipartisan value that everybody shares, that we all need to have access to this data for the betterment of our country and the betterment of our own personal health.
I love it. That's great to hear. So let's talk about Rebel Health. This is your book, A Field Guide to the Patient-Led Revolution in Medical Care. Now, many listeners of this podcast are nodding along because they have lived this story. The We Are Not Waiting movement alone in diabetes, to me, defines what you're talking about. And I know you've written about it. So let's just jump in. I don't want to ask you to give me the pitch for the book necessarily, but when you talk about Rebel Health, how do you describe this to people?
Well, after 20 years of spending time on the front lines of the online healthcare revolution, I can say that one of the most exciting aspects of technology is that people are able to talk to each other. People are able to gather online, to share their stories, to organize politically, to share the tools that they've created, to share the code that they've written with each other. And it's a radical change from the time when we might have been able to gather in person geographically for support groups. Now we're able to gather globally, and it's incredibly empowering for people.
It is amazing. I think back to my son's diagnosis with type 1 was 2006, before the iPhone, before most of social media. And we were very fortunate because we had an in-person community. My JDRF was wonderful here in Charlotte. They had a lot of in-person events. And I had been able to meet people even before my son's diagnosis just because of a confluence of happy events working at a radio station. But it wasn't until I found, it was on Twitter really, I found the diabetes online community, blogging, weekly chats on Twitter, that I was able to learn so much more. Can you talk a little bit about the beginnings of all of that? Because it wasn't just diabetes, right? When in the gosh, I guess the late 2000, like, what do they call that? The aughts, right? It was the aughts when we all started finding each other. And I know it changed from there, but can you talk a little bit about those early days?
Yes. I had the privilege of working with Tom Ferguson, who was a medical doctor who was a very early advocate of online health communities. And he, for example, when I started doing this work of going into online communities, it was because Tom had counseled me that if you want to understand the future, you need to spend time with patients, caregivers, and survivors. He had seen this kind of work happening in the 90s, really before Google, before the World Wide Web. He had seen it happening on bulletin board services and email listservs. People who, for example, had suffered traumatic brain injury, who were starting to gather at the doctor's office in Boston early. They would come to the waiting room early for their appointments so they could talk with each other. And doctors noticed that and started a bulletin board service. That was one of the early ones that happened in the 90s. Then when social media came along, it seemed like everybody just ran out of the gate and started shouting, I'm here. Can you find me? Is there anybody else in here? Because healthcare is a maze and you often feel like you're alone, but you're not alone. And what I wanted to do was write a book to help explain this phenomenon to people who have not experienced it. And that includes all of the regular people who have not yet had occasion to gather online, to try and find someone like them online, to engage in peer-to-peer healthcare. I also wrote this book to introduce these concepts to the C-suite of healthcare, the CEOs, the people who sit in boardrooms who have not had the privilege of spending time on the front lines of the healthcare revolution, because this is now everywhere. And I think it's one of the most hopeful things that's happened in the last 20 years, that people are able to gather together and solve problems.
There's a lot more to say and many more questions to ask. I feel like I'm sort of cheating, but I'm going to skip to what I would say. I'm going to skip ahead to the end almost. From where I sit, and I may be biased because my son is now a young adult. He's almost 19. So my involvement in his diabetes is very different than it was 17 years ago when he was first diagnosed. But with with kind of I'll choose my words carefully, with what we can call the change of Twitter, maybe the decline, we'll see now that it is X, people being much more careful about what they share, or at least being told to be more careful about what they share, and kind of a bifurcation of social media. Are people still sharing in the same way? It just feels so different than it did 5 years ago, let alone 10.
I don't know whether people are sharing different information. I do see that the conversation is becoming quieter on Twitter, or the platform formerly known as Twitter. And that worries me because Twitter has been one of the most open platforms, one of the most international platforms that allows people to search, for example, on a hashtag like We Are Not Waiting, and find other people who share the same ambitions, who share the same pain points. And we don't necessarily see that kind of open platform anywhere else right now. However, I am an optimist. We saw enormous change when the World Wide Web was introduced and people adapted. We are going to continue to see change as these platforms change. I really feel that the online healthcare revolution that is being led by patients and caregivers and survivors is like water in that it seeps into the cracks of a broken system and widens those cracks. It finds its way like a river through a canyon.
Yeah.
And what do you say about water and a rock? Like eventually the water will win. And that's how I think about peer-to-peer healthcare, that people will find a way to connect no matter what happens, whether it was a bulletin board system or an email listserv, or whether it was the age of the blog when people were sharing their personal stories and connecting in the comments of a blog, or whether it was the era of Twitter when a hashtag could rally people. I think we're just going to continue to see the technology evolve and the movement expand.
I love to hear you say that. I'm thrilled. I mean, I'm starting over on Threads. We'll see what happens, but I just feel so lucky that I was able to connect with the people that I did over the last, 15 years or so. So I'm glad to hear you say that. Let's talk a little bit about, you mentioned We Are Not Waiting, and so did I. You've written about this. It's such a fascinating example. And I was excited to see, you broke it down in an article that I can link up here. So as you listen, you can go back and read it. But talking about, and I hadn't thought about it in this way, the steps that happen when communities find each other. Can you talk a little bit, you broke it down kind of in the elements to look for here. When you looked at the We Are Not Waiting community, what did you see through your eyes? Right back to our conversation. But first, Diabetes Connections is sponsored by Gvoke HypoPen. Gvoke HypoPen is a ready-to-use rescue pen for treating very low blood sugar in people with diabetes ages 2 and above. If you take insulin or sulfonylureas, you're at risk for your blood sugar going too low. Low blood sugar emergencies can happen unexpectedly, and they demand quick action. You need a safety net when it matters most. Be ready to treat very low blood sugar with Gvoke HypoPen. Find out more. Go to gvokeglucagon.com/Stacy. That's gvokeglucagon.com/STACEY. Gvoke shouldn't be used if you have a tumor in the gland on top of your kidneys called pheochromocytoma, or if you have a tumor in your pancreas called insulinoma. Visit gvokeglucagon.com/risk for safety information.
The We Are Not Waiting community is a perfect example of the rebel alliance of healthcare. They are people who were fed up with the status quo, where a lot of mainstream healthcare was saying, what are you talking about? You're fine. We've given you insulin. We've given you a continuous glucose monitor. It's not enough. And instead of saying, I'll wait for mainstream healthcare to solve this for me, the Diabetes Rebel Alliance gathered online, started asking questions, pooling resources, and solving those problems. And here's what I saw. What I realized is what emerged from my observation of the Diabetes Rebel Alliance, as well as other people who have joined the online health revolution. There are actually 4 types of people that you'll meet in the revolution. There are seekers, networkers, solvers, and champions. And the We Are Not Waiting movement actually embodies all 4. So they're one of my favorite groups to talk about. Seekers are people who say, I am not getting my questions answered. My problem seems to be invisible to mainstream healthcare. I am going to go out on the hunt. I am going to go look to see whether I can find the answer for myself, whether anybody else has this problem. I'm going to go out and look. And that's the spark. That's the beginning. The second group that I talk about are networkers. And those are the people who raise a flag or put up a hashtag or start a community on Facebook or wherever it is that they gather people together to start to talk about what are our pain points? What are the possibilities? What have you found? Let's start a list of all of the things that we really need to solve. Let's start a list of the solutions. And what I often talk about is that networkers are an early warning system for healthcare. And that's why executives need to be paying attention to seekers who are asking questions and networkers who are pooling resources and gathering a community. And so it's not just one person who has a voice, it's a whole community of people that have input. The third group are solvers. These are the people who look at a problem and cannot resist attacking it. They might have an assistive device that's just not working for them if they're living with a physical disability. They might have a medical device that, I don't know, let's say they want to get access to their own data. They will not be able to resist trying to hack into that device and free the data. It's also people who look at a system that's broken, a system that's not working for them and the people like them, and they will try and change that. For example, clinical trial redesign that's happening. The fourth group are champions. Champions have access to resources that are controlled by mainstream healthcare. And champions look across the landscape, notice what seekers, networkers, and solvers are doing, and they help them to scale up their innovations. And that can mean an infusion of money. That can mean an infusion of attention, like getting on a podcast, getting on into a major news outlet. It could also mean access to regulatory guidance. How do you navigate the FDA? A champion can make sure that a peer-to-peer healthcare innovation can actually reach millions of people, not only hundreds of people.
Yeah, I was thinking when you were going through those of the days of when We Are Not Waiting and the Night Scout group, which I know you're very familiar with, were called Rogue Cowboys by within industry. And then a couple of years later, industry adopted a lot of what the We Are Not Waiting movement had asked for and hired a bunch of those people. So it really is a great example of what you're talking about.
Yeah. And by the way, that mirrors radical health movements of the past as well, where, we've seen people who are in community and realize that nobody's collecting data about this. I'm going to collect data and I'm going to get the attention of the federal government. For example, the Black Panther Party noticed that nobody was collecting good data about sickle cell anemia. And so they went into community, created a community-led initiative to collect data about the prevalence of sickle cell. And this was in the early 1970s. And they were able to get the attention of the federal government and get the first funding to study this. And now we are on the verge, possibly, of a cure for sickle cell using CRISPR. We saw the same thing in the radical health movement against AIDS. ACT UP was a group of people who took incredible, in-your-face political action. And if anybody listening does not know about some of the incredible work that ACT UP did, just go to YouTube because they were also very good at capturing video of the actions that they took. Behind the scenes, they also were quietly working with Anthony Fauci, for example, and learning what it was to be influential at the federal level. And a lot of the work that ACT UP did that seemed like, as you put it, rogue cowboys, that is now really standard practice for a lot of activists. And the FDA changed the way that they do their work thanks to those activists of the 1980s.
It's interesting that you bring up ACT UP. I was brought back to a talk I heard, I want to say it was 2014 or 2015. It was at a diabetes event where an activist from the HIV community gave an incredible talk, really encouraging people in the type 1 community to band together with the type 2 community and get more angry about the price of insulin and get more vocal about issues that were not being addressed. And his point was, you guys are a very small voice. If you team up with these other 28 million or 30 million people with type 2, you can really make some noise and get some stuff done. And, he was it was really an interesting way to look at the issue of making noise and, bringing more attention to issues. And it was great that you brought up ACT UP because it really brings that point home. I'll link up some information and some videos to that too in these show notes.
Yeah, the coalition building is really important. And that is the work that networkers do. Networkers are people who can't resist except to gather together, build coalitions, and publicize that, hey, there's something going on here and you want to join it. Your life will be better. Your children's lives might be better if you join us. And by the way, what I found in my research is that not everybody is a networker. People often, when they think about the patient advocacy movement, people often think of networkers. They think of the people on Twitter and Facebook and people who are very vocal. That is not everyone. I met people who were seeker solvers. They were frustrated. They went out on the hunt to find a solution and they built one themselves. And then they said, that's good enough for me. I actually don't want credit for this. I don't, I'm going to share it with a couple people, but that's enough for me because I'm shy or I'm introverted or I have a whole other career that I'm pursuing.
Yeah.
And I'm not interested in being a networker.
I was kind of surprised that, and one of the ways that you and I connected was you posted on LinkedIn about my Mom's Night Out events, talking about how this was an example of the rebel health spirit. And I was really flattered by that. And I was also really surprised by it because I didn't think of it in that way. I mean, I'm not, it's not false modesty. I mean, I'm excited about these events. I'm thrilled to put them on, but it took me a little bit, it made me look at them a little closer because when you get moms of kids with type 1, I wanted to give them support, a little bit of fun in education, but you kind of turned it around for me to make me think of this as pure health advice. So I guess I'm not asking you, Susannah, like, hey, tell me more about how great I am, but it was really exciting to see you put it in that context. Can you talk about these in-person events, not just Mom's Night Out, and how they are part of what you're talking about?
Absolutely. Joy is a radical act. And if people are not able to gather together and celebrate the victories, if they're not able to gather together in mourning and cry on, the opposite side, we are not going to survive the humanity of illness. And something that strikes me every time I talk with people who have been through hardship is that if you are feeling vulnerable and frightened because of a new diagnosis or because it's been a really long slog, there are people who would love to support you. If you just raise your hand, if you are brave enough to say that you need help, there are people who would drop everything to come to your aid, whether virtually or in person. And it is a radical, wonderful notion that we can gather together in community, in support of each other, in good times and in bad times.
When you said that, it's got me a little emotional. So it's just,
yeah,
it's great to think about. It's hard to say I need someone else. It's hard to say I can't do this alone. I've been one of those people who said, no, I got this. I've got this. And when you let go, it's hard, but it's incredibly, incredibly rewarding. I'm so glad you put it that way. Thank you.
Well, and the other thing, if someone is not sure that they want to raise their hand and ask for help, sometimes the first step is volunteering to help someone else. That might be the right path for someone to say, I know a few things and I am going to volunteer to help someone else who just started out on this journey. And by doing that, you might see that you can ask for help too.
Why write this book now? Why did you decide to delve into this and to put this book out now?
After spending about 14 years as a researcher, I started getting invited into boardrooms. I got invited to take the role in the Obama administration as the chief technology officer at HHS. And what I found as I got invited into these higher level conversations about healthcare is that my friends in the C-suite of healthcare often wouldn't believe me when I told them stories about my friends and colleagues who are part of the Rebel Alliance. And
wow.
So I decided to write the book as a field guide, literally to say, hey, these are the two groups that I know best. I want to introduce you to each other and talk, for example, to CEOs of hospital systems and health plans and policymakers to say to them, it's going to be a competitive advantage in the years to come that you understand the power of seekers, networkers, solvers, and champions. And I also want to say to the general public when you have a healthcare crisis, and unfortunately for all of us, it's not if, it's when, you are going to want to step into your power. Here is how you can do that. Whether you become a seeker, a solver, a networker, or whether you recruit one to your team, this is how you can step into your power.
I'm fascinated by the fact that some of these C-suite guys don't believe you. When you talk to them, have you convinced anybody? Like, what's the turning point for them? Do you have to schlep them to some of these events? Do you show them the "we are not waiting" hashtag? Like, have you turned it around for any of them?
What I love to do is I'm often hired to do a health data project, and I reserve time at the end of a presentation. And I say, that's my presentation, but if we have a few more minutes, I'd love for you to tell me, what are the 3 business objectives that are really challenging you this month? And then I tell them how the patient-led revolution could help them. If they have a problem, for example, where they have a new product and they're just not able to get the word out about it, I say, this is when you need to talk to networkers. Networkers are able to spread the word about something that's good. And by the way, you should talk to networkers before you design a product because they can give you feedback about it. So that's one way that I'm able to convince people that this is a movement that is worth paying attention to. The other thing is to talk to people about their own experiences in healthcare, and to talk to people very often after I give a talk about a caregiver who's made an incredible save, or a patient who is able to create an innovation that improves their life. It sparks something in the listener, and people often quietly come up to me and say, now I understand. I had that experience, or I have someone in my family who has had that sort of experience. And so it's in the storytelling that I'm able to break through people's doubt. So often it's just that it's currently invisible to them. It's not that they don't want to see the incredible, innovative work that patients and survivors or caregivers are doing. It's that they don't have a lens. They don't know where to look. And what I'm hoping to be able to do is point out to them where they can find these amazing people.
Susannah Fox, thank you so much for spending some time with us. We will link up every place that people can find the book. But thank you so much for sharing that, for talking with me. And I really look forward to talking with you again, I hope. Thanks.
You're listening to Diabetes Connections with Stacey Sims.
More information in the show notes. As always, you can head on over to diabetes-connections.com. The book, Rebel Health, is available for pre-order right now. It officially comes out in mid-February. I am just jumping into events. I am off to She Podcasts Live this week. I'll be back for Mom's Night Out Charlotte, February 2nd. And then we kick into high gear planning for the next 3 Mom's Night Out events. We will be in Chicago in April, Denver in September, and Philadelphia in October. I'm going to be keynoting with Carrie Sparling, the Boston area JDRF Type 1 Nation Summit in March. Lots going on, and I hope to see you at some of these events. I think I have something almost every month this year, but drop me a line. Happy to come and speak at your event. I have a whole bunch of talks that I give, and those are all over on the website under the community tab. Thanks, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.
I'm amazed how hard these automated insulin delivery systems work. Omnipod 5 automatically increases, decreases, or pauses insulin delivery every 5 minutes. This technology is called Smart Adjust, and it's in the pod. This means if you're out on the football field and the controller is in your bag, the pod and Dexcom G6 continue to talk and make adjustments. That would have been awesome for us in middle school when Benny played football, or when he was backstage at the school play. All that, and you get the freedom of no tubes. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.